jobs can come and go and your work can come and go. But if your home life, your relationships, your children are being negatively impacted by those things, then you got to take a step back and reassess, at least in my opinion.
But our family members have us, who have been both in the direct patient care system and in the payer system. Everybody doesn't have that. Like, what is everybody else doing, right?
If you say yes to everything, you are certainly saying no to something. And that is the antithesis of balance.
But I've gotten more than once the ivory tower comment. I'm like, I have no ivory towers. I don't live in any ivory towers. You know, I'm human just like you. And as I tell people, as myself a cancer survivor, I have been in all of those roles. I've been the patient. I've been the doctor. I've been in the payers. I understand what it feels like to be the patient. Welcome to the Balance to Excellence show, and welcome back to those of you who have been here. I'm Dr. Judy Wright, and today I have the honor of being able to interview the first man on our show. And I'm so excited about it to get that view. So we're excited to welcome Dr. Todd Otten. He's a board certified family physician and a co-founder of our Quadruple Aim, which is a movement focused on challenging the status quo in healthcare. Dr. Otten has 20 years of experience providing high-quality patient care, leading teams, managing projects in various healthcare settings, including his time in the U.S. Navy. Thank you for your service, where he was honored as the Naval Flight Surgeon of the Year in 2006 for the Atlantic Fleet. He's also the co-author of Ripple of Change, which is a book that chronicles his journey through burnout and the dysfunction within the healthcare system. This book offers a powerful, no-nonsense approach to reimagine and inspire positive disruption in healthcare. Currently, Dr. Otten serves as the Chief Impact Officer for Medicine Forward and is deeply involved in advocacy efforts across the country, empowering both patients and healthcare providers to become agents of change in this healthcare system. So we're really excited to have you, Dr. Otten. Thank you so much for being on the Balance to Excellence show.
Oh, thank you for having me. And what a very wonderful intro. I feel humbled. So thank you so much.
Thank you. So, as we often do, we're going to dive a bit into your journey into healthcare in the first place, like what made you go into healthcare, and just to understand how you then went from healthcare to what you're doing now.
For sure. So my journey into healthcare actually started when I was relatively young. I was probably about 16, to be honest with you, when I kind of thought I wanted to become a physician. And there were a few things that were woven into that a thought process, if you will. You know, the first one I did well in school, and I was always up for a challenge and always wanting to strive. So I think that played a part. But the other thing that really drew me into wanting to help others in the humanity aspect of things was I worked at a parks and recreation program in the summer. So 16-year-old kid, you know, we've got 60 to 80 kids that we're doing crafts and games with. And I went up the ladder, I suppose, to become a supervisor. And so I had an opportunity to not only be working with the children, but also leading others. And I loved those interactions.
Yeah.
And so it was kind of a blend of academia and a type A plus probably personality. And then that experience is what led me to want to become a physician.
Absolutely. I always talk about the type A personality that we don't often like to admit to, but we know we have it.
Well, if I may, you know, it's interesting. As you go through your career, you don't always realize like what your blind spots are and the things that you've got to work on. And when you start to become more self-aware of your flaws and maybe the things that we don't like to admit to rather, and lean into those things a little bit and learn from them as opposed to letting them be saboteurs, if you will. I think that's when it gets really fun, and you can take a step back and hopefully realize like, hey, this is not my wheelhouse. Like I need help here, or I need a coach, or I need a therapist. And I'm digressing a little bit, but I think you get the idea there.
No, absolutely. You're one, and I think that is a strength. I always tell people, like there are certain things that I've done, and I said, I know medicine. Let me tell you, I really know medicine. And it's weird to have, for some people, they're like, well, you're an MD. This is my wheelhouse. This is a steep climb. I'm willing to take the steep climb, but I'm going to tell you, I'm going to need help because I know medicine. That's what I know,
Mm-hmm.
And I can pick up on other things, but it's a steep climb for me. And so, but medicine was a steep climb when we were learning it, right? So I'm always willing to do the challenge, like you said, but it's important to know your lane and know when you're going to need that help. So I 100% agree.
For sure. You, for whatever reason, you reminded me of like one of the first days in medical school, and it was with the intro, and they're like, okay, imagine you're standing in front of a fire hydrant, open your mouth, start drinking, and get as much as you can. And I'm like, oh my gosh, this is what's going to happen. And there's a lot of truth to that, I would say.
There's a lot of truth. There was a lot of truth. I remember saying to my Mom, you and Dad didn't start wearing glasses till you were in your 50s, right? And I need these glasses. I'm in my 30s. She said we didn't have to read the volume of stuff that I see you bring into the house to read and go through. I was like, okay, when you put it like that.
Yeah. Oh, yeah, here's a stack of notes. Memorize this in 2 weeks and we'll have a test. Oh my gosh.
Absolutely. And so you were doing, you went into, did you immediately go into family medicine? I saw that you got Surgeon of the Year, which I know as family practitioners, what do we always say? From the womb to the tomb. So we do a lot. But did you always do, was it immediate family medicine for you?
No, actually, it wasn't. And I would say when I got out of medical school, I wasn't 100% sure what path I wanted to go down. Again, I think that type A, whatever personality said, well, let's be a trauma surgeon. You liked operating, you liked challenges, you liked taking care of sick people. And that was really true. I really loved my intensive care unit months and really trying to help people through some of their darkest moments. And so when I got out of medical school, it was 2002. And in the Navy, typically what happens is you pay back your time first before you finish your training. So my first year out, I did a year of internship in general surgery. I loved operating, learned an absolute ton, but I can't say that I appreciated what I would consider somewhat a sadistic culture, if you will. And so fortunately, I was in the U.S. Navy, and I then trained as a flight surgeon, which is how that all came about. And I loved it. Flight surgery is a complete misnomer. It's really primary care. Basically, imagine you're like a family physician taking care of a squadron of about 500 people plus or minus, and you're responsible for just about everything: paperwork, physicals, getting ready for deployments, managing things while you're overseas, that kind of stuff. So I did that for, I was about 3.5 years as a flight surgeon. And when I finished up my time, I came back to Michigan and then did my residency in family medicine in the Detroit area.
Got it. Okay, that makes sense. And thank you for explaining that that's a misnomer, because I would have never. I thought it was surgery, but it's everything.
Yeah, people are always like, "Well, did you operate on a plane?" I'm like, "No, I didn't operate on a plane."
That was going to be my next question. Thank you.
Yeah, for sure. I did do procedures and stuff, but we were safely on the ground. We weren't in an aircraft.
Yeah.
For sure. Yeah, and so actually from there, I guess I could continue on with the story if that's okay. Kind of how I got into this position that I'm in now with advocacy and networking and stuff. So after residency, I joined a critical access hospital, and most of it, Judy, was great. I love seeing patients. Like many of us and many of our colleagues, it is truly a joy to take care of other human beings, especially when something goes well, where you get that positive feedback. It is really hard to describe that euphoria that exists with that. But like many of us, I was doing way too much. I was chief of staff, I was the ACO medical director, and I was literally seeing about 6,000 visits a year at the same time, which is a lot. It's a lot. And it was all well and good until it wasn't. And then, my balance had gotten like out of whack during that time frame. I mean, I was starting to get really burned out, and then I had two charts pay withheld because I had two open charts. Two. I mean, you talk about ridiculous. I mean, that's just in and of itself is ridiculous. And the wheels came off the bus. I was ready to quit. I was like, you think you can be a better chief of staff? Do it yourself. I quit. And then my CEO gave me some time off. And then I came back, and, I think back about that time, Judy, and I was broken. I can laugh and joke about pieces of it, but I'm looking out my backyard as we're sitting here chatting, and I remember sitting out there crying, just hating the job that I loved. Same job, hated it, didn't want to be there, didn't want to go, and it was a rough stretch, and my balance at that time was totally out of whack.
Oh my goodness. I am so sorry to hear that happened to you. But the thing also is it happens to so many. And I understand it because I went through, and the funny thing is I can't say I went through full out burnout. But my reason was because I would just leave and go somewhere else thinking that would solve the problem. Right?
Mm-hmm. I possibly have heard this one before.
Right? I'm like, I'm not doing this. And I would go. Or something would close down, and I was so happy it was closing down. But I would think that going somewhere else to solve the problem, not realizing that anywhere I go, there I am. And so I also have to solve the problem within me. So I totally understand what you're saying, because there's a mindset shift that has to happen once you're pulling yourself out of the realms of burnout. There's a mindset shift that has to happen.
100%. Well, and oftentimes it's you're jumping out of the frying pan into the fire, depending on the circumstances. I had a buddy who he was in a transitory period, and we were talking about things along these lines, and I said, well, why do you stay? And his response was, it's the evil I know. And I'm like, oh my Lord, that is disturbing and true on so many levels. Oh yeah.
Honest. It is disturbing and so honest, right? Like you just said that you around 16, right, is when you realized you think you want to become a doctor. For me, I was like 8 years old. But what I always tell people is many people who are doctors realized that they wanted to do that early and started to gear everything that they do to becoming that, to getting into a particular college, to doing well in college, so that they can get in medical school, so that they can go to that and get into a good residency. And that takes so much that all your eggs end up in this basket, and your identity gets tied up in that same basket. And so it does become the devil and you don't often see how you can, if you were to, I don't even want to say leave it, but if you were to do something different, it's hard for you to see something as something different to begin with. And then you're like, I put so much into it. What else am I going to do?
Well, that, that's an interesting, oh wow, there's so much we could unpack there. The whole identity thing I think is true. And I think what leads to a lot of our colleagues to struggle and have unfortunate consequences depending on the circumstance. And, I talk about it a lot, God forbid, suicide being the worst of all of them. I don't know about you, but I've had 4 of my colleagues in my career who are no longer here. One was a friend and one was a partner, for goodness sakes.
Wow.
And I just stuffed it in a box and just kept going and didn't even deal with it. And that's a whole nother can of worms. But I think you know what, I'm going to continue. I'm going to tell you another story if that's okay. So I come back from burnout, right? And, broken for a while, took probably a good 2 years to really start to heal, not start to heal, but be closer to my normal self, if you will. And it was at that point that I started writing the book, Ripple of Change. And I'll give my shameless, I'll hold it up. I show everybody.
Yeah, please. It's a nice sizable book. Love it, but I got it.
Oh, bless you. Thank you so much. I hope you enjoy it. But anyways, so I started writing, and the first thing I wrote was a poem called Medicine is a World of Gray. And it was really kind of a dark look into primary care and some of the frustrations and problems that exist. The second thing I wrote was called Anatomy of Burnout. And it was really a look through a physician going through burnout, not just from my eyes, but from my medical assistant's eyes, my family's eyes, my boss's eyes, my friend's eyes, and all the negative impacts that occurred because my life had gotten out of balance. I mean, just completely out of balance, and it was a mess. The book got very interesting when my co-author got involved. Joshua Judy, it was one of my former patients, and he was struggling with cervical radiculopathy, pinched nerve for any non-physicians listening to this. And I was running out of ideas for him. And so I wrote him for a medication called Cymbalta, duloxetine, which I still take for my post-concussive headaches because it actually was the first thing that allowed me to have a headache-free day. Anyways, I digress. Mm-hmm. He had horrible, horrible problems related to that medicine. And I told him about the book and what I was doing, kind of in hopes to maybe try something different to get some healing for him. And my only prescription to him was to just write. That's the only thing I told him to do. And he did. And it was good. And then we had a meeting about it. And the book took on a very different path after that. Very different. So we go back and forth between doctor and physician and how our lives intersected and how we impacted one another. But really with a theme for everybody to do something to improve the mess that we're all in now. And I truly believe that if enough of us do something, even if that's as simple as writing a thank you card to your clinician, I mean, that can make all the difference in the world. That one little pebble into the pond can have tremendous positive ripple effects, if you will.
It does. It absolutely does.
Sorry, Judy. I'll be quiet. Sometimes I get on a roll.
No, I was agreeing with you. It does. Sometimes you would have such hard days, and it just the whole day or even the whole week was hard, and one patient said something that transformed everything. What hard week? That one patient said something, and you're like,
what is it? The heart thing like this? Yeah, right. Yes, 100%. I agree with you. And it's those little things that are often missing as we've gotten into this transactional profit over people system. Not all the time, right? There's some amazing, beautiful things happening around the country, both at the local level and hospital level and what have you. But we need to scale that, and we need to really take that to the next level, which, gosh, I'm really giving you a long-winded answer. I wasn't expecting to do that. So
please give the answer.
So the
thing that other medical professionals need to hear, because as much as we work around each other, what is weird to people is we're so incredibly siloed as well.
Oh yeah.
Right.
Oh yeah.
and the silent thing is a lot of us are not directly but almost indirectly taught to work kind of alone. If you know what I mean.
Oh yeah, I agree with you.
And so even though you may have an entire staff around you, may even have other colleagues, we often don't talk to each other about the things we're going through. and think we're going to look bad if we say anything. So we don't. So this is the kind of stuff that people need to hear and understand. And understand, as a medical professional, as a physician, a nurse, and a nurse, you're not the only one going through these things.
Well, yeah, and we're all human beings.
Yes.
We're all in this, game of life together. And the more we can love and respect and care for one another, the better. Oh my gosh, it would be so much better. It would be so much better. So I'll finish the last little bit here. So in August of 2022, things were going great. I was supervising 3 nurse practitioners, and in the book, I dubbed that chapter of the office Utopia, because we really lived the quadruple aim. And for those that aren't familiar, essentially that's patient experience, quality care, lower costs, and provider wellness. And I'm aware that some colleagues don't like the P word, but if you think about it, or the way I thought about it, whether the person is delivering your meal or taking out the trash out of the room, or it's one of the nurses, they're providing something, and hopefully they're doing it in a loving, empathic, and caring manner. But as all good things, I guess, come to an end, I had a CEO and a VP come in and say, "Hey, Todd, we got a great idea. We're going to move your clinic back to the town you got burned out in, because we can save money on rent." That's pretty much the look I had right there, Judy. I was seething. I was so upset. I went home, I told my wife, and she started bawling. I'm like, that's it. This was coming. This has been building. Like, they're not listening to my pleas for my colleagues for wellness and doing the right things. Judy, I literally resigned the next morning. I've been there almost 13 years. And I think everyone kind of thought I was nuts or passionate or something, but I was in a position to take a stand. Mm-hmm. And it has led me on this amazing journey of what I'm doing now, which is I still do a little bit clinically now. I came back to that, but I do a lot of networking, a lot of advocacy. We've got some amazing projects in the works. If you want to join a group of a bunch of us, here it is. And you don't have to be a physician. We've got nurses, we've got physical therapists, we've got patients, we've got people who want to catalyze positive change. And so, yeah, if I think back, and if all those things hadn't happened, I wouldn't be sitting here talking to you. I don't know that the book would have got finished. And as painful as some of those moments were, I'm grateful they happened. I'm glad I was able to learn from them and take them into this, next phase of my life, if you will.
I agree with you. That's an amazing journey. Nobody really wants to go through burnout, but if you take the opportunity, which you have, you've learned so much from it, and it's guided some of your principles. And so let me just say this. When I first reached out to you, I didn't even know about this quadruple aim. And when I looked at it and I got to the provider wellness, I was just like, I was like, yes, right? Because, it's all encompassing. What I used to say is, you would walk into the hospital, anywhere, any healthcare space, and everywhere you would turn, you would see these patient bill of rights, which I 100% I'm in agreement with the patient bill of rights. But then I used to say, what happened to the physician's bill of rights and the nurse's bill of rights and this, right? Like, like what happened to that? It's like the forgotten piece that, as you said, we're humans too, right? How did that get forgotten out of the fray? How did our wellness get forgotten? And it's very insidious. Nobody teaches us how to take care of ourselves. So everything that you were going through, you've learned from. Everything that you learned in the Navy, and you learned as a flight surgeon, and you learned, as director of the ACO, and all of that, you took all of that, but even in the hard time of going through and through burnout and recovering from it, has brought you to this space, this well-needed space to gather all these healthcare professionals who want to see a difference And I always tell people the healthcare system that we've been dealt. Because this is the healthcare system we've been dealt, but it doesn't mean that we can't do something.
I agree with you 100%. And I'll even, there's so many threads we could go down with this. I love these conversations. So in the book, Joshua and I, we were talking about this. And one of the beautiful things of that relationship was, well, I was a morning person and Joshua was a nighttime person. So I would tend to do writing in the morning and he would get to review it at night, and then he would do writing at night, and you could see how it would go. But we would push back at one another at times, with concepts and the title. For example, Joshua and his wife, Megan, and I'm forever grateful for this. I wanted to put like the quadruple aim in the title of the book. And they were both like, Todd, no one other than this small piece of people in healthcare are going to know what you're talking about until they read it. And it took a couple months for me to give in, probably. And the funny part, neither one of us can remember who came up with the title Ripple of Change. Honest to God, neither one of us can actually remember who came up with it, which I think is even cooler. Yes. But then we really talked about the quadruple aim, and we both were of the mindset that it needed to be elevated. It needed to be taken to another level, or maybe a different level is another way to describe it. Not another level, but a different level that's more empowering and simplified. So really that's where the word our came in. Mm-hmm. So we dubbed it our quadruple aim, not mine, not Joshua's, not Judy's, but all of ours. Yes. All of ours. And that actually is really akin to the quintuple aim. So not to confuse the audience per se, but the quintuple aim in its simplicity is patient experience, quality care, lower cost, provider wellness, but health equity. And when you configure those 5 together, it's magic. And there are people out there doing great work around this framework or this lens. I think all too often we see our colleagues in administrative roles or whatever looking at short-term ROIs and how it impacts a certain silo. I think the best leaders are taking a look at the bigger picture, total cost of care, and using those types of frameworks to say, okay, if we make a decision here, how is it impacting all these other things, right? Which comes back to
absolutely
balance. Comes back to balance.
Absolutely. Oh my goodness, you're right. There's so many threads we could go.
That's good though, because that usually means it's a good conversation, right?
That is so true. And even as right now I don't work in patient care. I work as some people say, you went over to the dark side. I actually work in I'm in the payer system.
Okay.
And I thought it was very important to do that because I know what it's like on the other side, and I'm able to bring that here, right? Where it's not just about numbers. It's still about taking care of people, right? So, and what that means. And when you have somebody that's been in the space where they were actually the people who were working with their patients and understanding that part of the system, it helps to be able to bring to this part and say, okay, I know you're looking at these dollars here, but let's talk about the bigger picture. All right? Let's talk about the bigger picture. And
I agree with you.
Somewhere else. This is going to cost you big over here. And all because you were trying to save a few dollars down here. All right?
Oh, Judy, you know what? You hear that a lot, that you've gone over to the dark side or whatever, but I agree with you. I will often say we need physician leaders or clinical leaders or nursing leaders who, the vast majority of us got into this profession because we wanted to help other people and we wanted to do the right things. And we need that cohort of individuals at the highest levels, not just in clinical care, but with payers, and helping to unwind some of this dysfunction that has been built up over the years. I mean, you think about when they came in to move my clinic to save on rent. I think the number they quoted was, well, it doesn't matter. But me leaving cost them probably 3 to 4 times that amount of money. And then, and not over long term, like the next year. We had 15 individuals working at that clinic, Judy. And when I made that decision, I looked at the numbers and said, okay, how many people are working here now? 4 months later, 9 of those people left the system, including 3 providers, 2 nurse practitioners and myself. What a tremendous loss to that health system because of a decision to save money on rent.
Right. And you
Lunacy.
didn't just lose a physician or a director, right? You lost people that understood that area, understood those patients,
Mm-hmm.
right? And we need to put back, value into that. You're losing people that understand. Now you have to retrain. Yeah, you could come in as a nurse or a physician, but every part of the system is different. Now you have to retrain those people, and those people are going to have to build a rapport that you already had, right? And you may lose patience behind it, because I can tell you that when I left I left a clinic once, and the other clinic was across the water, and I didn't even know if where I was gonna be. So when they were saying, "Where were you going, Dr. Wright?" I said, "I don't know yet." And I went, Todd, and these lovely people found me months later. They kept searching.
Yep.
They just were not happy with the rest of the people at the previous clinic. And they literally, if I can explain to you, had to take a train from one part of Manhattan all the way down to lower Manhattan, then would have to get on a ferry to go over to Staten Island, then had to get on a bus to, once they got off the ferry, to get to me. And I'm just like, what are you doing? But it meant that much to them to do that. And that's the kind of thing. This is not an ego thing. This is how can I not be that provider for you when you've done all of this to see me? That's not an ego thing. It was like, I gotta be here for you.
To me, that's a relationship thing. That's a trust
Right?
thing. That is everything that healthcare should aspire to thing, you know?
Right. But I left, and so did several patients, not because I tried to take them.
Mm-hmm.
Right? So we have to be very careful. And it's not, I left, it wasn't specifically because of them. It was some other stuff that was going on. But we have to be very careful when we're talking about some little minute rent cost or, right? We have to be very careful and see the bigger picture.
100%. It would blow my mind when we would be talking about these decisions that were just being seen under this myopic lens of money. And I am not discounting the fact that you've got to have some component of a margin to make things successful, right? But the interesting part of that was, in every situation where we paid attention to the quadruple aim or the quintuple aim or whatever it was, there was never a problem with money coming in. The place would be busting at the seams with patients because you were treating them well. It's like, this isn't rocket science. Like, it would drive me nuts sometimes. We had to come up with a business plan to hire one psychiatrist for a physician group of 350 physicians. There were 3 physicians and 3 administrators spending this time building a business plan. And I understand you got to have some component of business plan, but I said the business plan should be this. If we can keep one primary care physician from quitting, that will have paid for itself, because I am treating schizophrenics and I am a family physician, and, I love doing the best I can, but that's not my wheelhouse. Right. And so if I had somebody to refer to, the whole conversation was just this circular conversation of finances and justifications and all this stuff. And I'm like, wow, we're so far from just doing it because it's the right thing to do.
Yeah, absolutely. So what I like, first of all, I had never, and I'm not saying it never has been, but I had never seen a book like this where both the doctor and the patient were writing in the book. I'm like, this is 2-3 books in one.
Yeah, don't be intimidated. That's why it's a little bit thicker, because you're spot on. It is like 2-in-1.
It's like 2-in-1. And honestly, when I got it, I was like, "Ooh, this is a big book." And then when I really looked at it again, I said, "This is like 2 and 3 books in one," because it's like from Dr. Otten's view, and then this is like from Joshua Judy's view. But then there's like also kind of the coming together. So I'm like, this is like 2 and 3 books in one book, and nobody should be intimidated by it. And and the writing is not too small, because in these days, I feel like everybody's font is getting smaller and smaller.
And interestingly enough, Judy, the reason for that is my co-author Joshua has a very significant retinal issue, which he describes in the book. And so we had a conversation, like, to be, to honor him and be appropriate to his capabilities with his vision. I was like, Joshua, we have to put it in a font that you can read. And of course that made it a bigger book, but
I noticed it right away and was appreciative. When I tell you, I was just like, oh, because everybody's putting everything in a font of 0.05. And right. I was like, oh, I can read this even without my glasses.
Well, thank you. And, the other part of it too is it's a lot of stories. It's a lot of humor, as hopefully you're picking up. I mean, it's basically this type of conversation, but weaving in different components of the healthcare system so that people can understand, like, what is a PBM? Why am I paying so much for my medications? And hopefully arm them a little bit to either educate themselves a little bit more, or even more importantly, potentially push back.
Yeah.
Ask questions, facilitate change. It's all these hopefully little tools that we were offering in there to, quote unquote, empower people to play their part.
100%. So back in 2020, 2 nurses that I worked with came to me and said, "We want to do a podcast." I said, "That's great. What's your podcast going to be about?" Because we talk all the time. And they said, "Well, it's going to be about what we all talk about all the time, which is," and what we all spoke about was how we would encounter things in the system with our family members, and we had to advocate for our family members. And we always came to the same conclusion every time we would have this conversation. But our family members have us, who have been both in the direct patient care system and in the payer system. Everybody doesn't have that. Like, what is everybody else doing, right? And so it became about that whole piece you were just talking about. How can we help people understand how to advocate for themselves? Or even their loved ones, how to advocate for them. Because medicine can be a different language, just like legal stuff can be its own language. Medicine can be a different language to people, and deliberately so. It's not easy to understand how to navigate. And so having these conversations, like the conversation you're having in Ripple of Change, is so important to, one, letting people know that you do have some power, because you can feel very powerless in the system. But 2, also, how do you start to advocate for yourself? You don't need to know everything, right? But it's helpful to know how to advocate for yourself so you can learn what you need to learn.
100%. I often will say we've got to unlearn learned helplessness. There are many of us who have gotten into this, well, I'm only one person, what can I do? And if we can unwind that, the more of us who are, maybe it's having a conversation like this, maybe it's advocating for a loved one, maybe it's having the courage to say no, or maybe it's the courage to check on a colleague. How are you doing? Are you okay? I mean, are you okay has a lot of potential impact for those of us who are taught to just suck it up, buttercup, so to speak, and stuff it into a box. I mean, that could potentially save somebody's life, depending on the circumstance.
Even if, because I'm not afraid to say it, are you okay because I can be very stoic sometimes, but are you okay if you're in the moment can bring you to tears? But sometimes that's the cry you needed to have. That's the catharsis, that's the release that somebody came up and said, are you okay? And in that moment, you realize, no, I'm not okay. You know, but somebody asking you that question made you have to stop.
Well, I agree with you, Judy, and it's really an invitation. It's an invitation to say, it's okay to not be okay. It's
Mhm.
okay to grieve. It's okay to talk about the case that didn't go well, in a safe space. And we've got to do a lot better as a group to support one another and have these, safe communities. And, obviously I'm a big fan of Medicine Forward. But it's an amazing place for our colleagues to join. And ultimately, we really want to be a catalyst for positive change. And so it's exciting to be a part of. Yeah. So there's opportunity at the individual level, the hospital level, and even the national level when it comes to these types of things. So,
Absolutely. So I wanted to ask you something, because when I looked at your LinkedIn, one of the very first things that I noticed is you described yourself, like literally, first two words: husband, father, then family physician, and then you said positivity disrupting the status quo of healthcare, right? And we were talking about balance. So let me ask you, Dr. Otten, before all that happened with the burnout, is this how you would have described yourself originally? First and foremost, husband, father, family, then family physician, because it resonated with me, how you described that, and this is LinkedIn, right? And
yeah,
that was the first thing you had, right? And it struck me. So yeah.
the God's honest truth to that is I probably wouldn't have had that. I probably would have done what, kind of the classic thing would be, family physician, list some accolades and all these other things. But it was going through that process. And then even more recently, I realized I had never grieved a lot of these losses. And that just reaffirmed my belief that, those things need to be in the forefront of my mind. Jobs can come and go and your work can come and go. But if your home life, your relationships, your children, are being negatively impacted by those things, then you got to take a step back and reassess, at least in my opinion. So yeah, it was very intentional that I did that on LinkedIn. And what's really cool about it is people notice it. Like it almost is like something like, oh, stop, wait a minute, this isn't the standard profile. What's different here? Why? And it's just really, I think, simply just because I put those two words first, it leads people to want to be curious and maybe lean in a little bit more. Which, yeah, you're right, Judy. 10 years ago, I wouldn't have done that. It probably would have been absent. And frankly, shame on me for being that way. But again, life's about learning. And in all these difficult, not all these difficult times, but the handful of difficult times that I've endured have led to us being here, the right place, the right time, the right people, and to be a part of what I really am optimistic about going forward, which is positive change. Because there are so many of us out there that are starting to connect and starting to talk and starting to push back. Actually, I'll digress, as I often do. I get on a roll and then I start talking about something else. We've got a cool project in the works for a documentary around these topics. And I won't spill the beans too much, but interviewing physicians and other key individuals to pull back the curtain on what's going on the other side of the fence, so that the American people can really say, oh my goodness, I didn't realize we were having a physician die on average once a day in this country from suicide. That has to stop.
That absolutely has to stop.
Enough is enough. And so stay tuned on that one. That's going to be a very hopefully cool project.
I will. I think work like that is so important so that people can realize that as we are doing our best to realize your humanity, please realize ours as well, right? We're not perfect beings. I've gotten more than once, not to my face, not to my face, but I've gotten more than once the ivory tower comment. I'm like, I have no ivory towers. I don't live in any ivory towers. I'm human just like you. And as I tell people, as myself a cancer survivor, I have been in all of those roles. I've been the patient. I've been the doctor. I've been in the payers. I understand what it feels like to be the patient, and I don't underestimate that. The first time I had to have an IV placed in my arm, I was like, "Woo, is that what the patients feel when we do that?" And it was the first time, and just that simple thing changed how I would approach people when I was doing their IV. It changed it.
Yep.
I was like, was that? Oh my God, that hurts. And so empathy around that, or even doing a finger stick, empathy around that, So as we really understand and do our best to understand your humanity, please, a documentary like this can show the humanity of what healthcare professionals are and what they go through as well.
Yeah. Yeah. Well said. So well said.
So what kind of things do you do to maintain your balance
well, I will freely admit it, occasionally I don't do the best job of saying no to things. Although I've gotten a lot better at, I would say, picking and choosing for me. And I have the luxury of this too, with the work that I'm doing, that I can kind of pick and choose the things that fill up my cup, from a work perspective, which is such a blessing to be in a position like that for sure. But I think there's that gut instinct. Like if you're doing something and it's not that it just doesn't feel right. I've started to listen to that a little bit more and pay attention to that, because there's so many opportunities out there to do advocacy work and networking work and so on and so forth. But as you said before, is it in my lane? Is it truly in my lane?
Yeah.
People talk about superpowers and these things, and I've thought about that a lot over the years. What is my superpowers? And I don't know that I have a canned answer for per se, but I think leadership tends to be one of the things that I've always found myself in. Like I always tend to land in leadership roles for whatever reason. I've learned to embrace that and accept that and not be afraid of it, even if I have a bit of that imposter syndrome there. And the other thing that I like speaking to. I love doing that and making these new relationships. And I think that goes with networking. And so when I'm choosing where I want to spend my time and my energy, I'm definitely setting some limits and not just taking every meeting under the sun.
Yes.
But then strategically picking things that I think will not only that I will enjoy, but that also I will think will have an impact. And I'll give you another example, maybe this will help. So earlier this year, I was truly missing seeing patients. And about a year prior, I had talked to an ER group that was debating starting to do some innovative things, blending emergency care and starting to not mix, but support primary care better is probably a good way to describe it. So I joined an emergency physician group.
Okay.
So there's 190 of them. I'm literally the only family physician in the group. But it's amazing because I bring this primary care lens to these projects that they've got going on. One of which is called the Right Care Clinic, which if you think about urgent care in the emergency room in terms of level of care, there's kind of a big gap between the two of them.
Yeah.
And the way our system is set up, the default is everyone goes to the ER, whether they need to be there or not, if there's no access, right? Strep throat, you don't need to go to the ER for that the vast majority of the time, right? Perfect example. Or, maybe even a broken bone that's not complex. You don't necessarily need to end up in the emergency room, but many urgent cares don't have the capability to deal with those things. So the group I'm with, Emergency Care Specialists, has developed what's called the Right Care Clinic. So imagine a clinic with an ER physician, an ER nurse, CT, radiology, labs, IV fluids, IV medications, but no facility fee. You just take that facility fee away.
Okay.
You are getting near emergency level care for a fraction of the cost. That is innovation. That is bringing new ways of care delivery to the forefront, but also paying attention to costs and also wellness. Maybe you've got an older ER physician who doesn't want to be in that high-paced, stressful environment, is looking for a little bit different pace. Great opportunity to extend somebody's career, right?
Yes.
And the cool part of it for the work you're doing is the payers are starting to go, this really makes a lot of sense. We want to be on board with this for a whole host of reasons. And so being involved in that kind of work also fills up my cup. And being able to celebrate it with this other work that I do and talk about it, in podcasts and teaching other people. So yeah, I mean, sometimes you got to get creative, but as physicians, I often joke, you could throw a dart at a map and there's a job there, unless you threw it in the middle of a desert,
Probably would still find a job somewhere in the middle.
Yeah, you're probably true. Telehealth, right? You could do telehealth.
Exactly. No, I agree. And I love that it also gives the physician, it gives the healthcare provider options. Like, it's not just A or B, right? It's not just hospital or clinic. It's not just, and even in what I do, because one of the things that I tell people is, there's so many ways that we can contribute positively to the system. And people think direct patient care all of the time, which is important. And I definitely want people to be in direct patient care, because I'll be honest with you, Dr. Otten, sometimes I get a little scared that, my God, who's going to take care of people if, we're all getting burned out. We're all saying we're not doing this. We're all, you're not going to deal with the system. And that could be a little scary. And so one of the things I do is try to empower healthcare professionals in a way that they're prioritizing their well-being first, so that they can move forward, right? And look at your entire well-being and engage in self-care and manage your stress and take care of yourself first, and make sure that's first and foremost how you're prioritizing your well-being. Creating pauses, right? Because nobody's going to do it for you. Making sure that you're creating pauses for yourself. Because when I see what's happening, for me, it's a little bit scary to know that this is happening to so many, physicians and nurses. And we do have nurse practitioners coming on, and physician's assistants, and your physical therapists. My son is special needs, and the schools are having a hard time finding speech therapists and physical therapists for the schools, right? For a number of reasons. So it's like, what's going to happen?
Well, I think you make a good point, and there's so many, again, just a ton of threads we could dive into to that. But I think that's where innovative care models and different ways of thinking about things. The group I'm with now, they also have a sabbatical program for their physicians. They've had that for 15 years. 15 years. And you wonder why none of their physicians ever leave, right? Because they're treated with respect, and they get a break, and they get a chance to take a pause and reset. I'm doing a new model now called complex disease management, where I'm not seeing a ton of patients, but every Wednesday I'll be in Grand Rapids, Michigan in person, and I'll see, one or two patients, but I have the luxury of spending like an hour with them and going through their whole history, helping them figure out where they're getting roadblocks or what I think the diagnoses might be, and then giving them a game plan that they can then take back to their primary care clinician or their specialist even to say, hey, I saw this guy, he's been around for a long time. Here's what he's thinking. And who's to say we can't use models like that to extend careers or allow clinicians to, work part-time? Maybe they just want to work a half a day a week, and maybe they only want to see so many amount of patients, and get them off the RVU bus, if you will. And why can't something like that work if you're creative with it? I think it can. But I think you're right. I think it has to be all parties listening to one another to develop these models, and them not just coming from one side of the house to the other side of the house, if you will, but having that collaboration. And I think that's when the magic can happen.
I love that. First of all, did you see the shock look on my face when you said an hour?
I did, because it's so not the norm, right? But we were talking about how can we get myself as a family physician kickstarted seeing some patients in the context of this ER group. And I said, well, here's an idea. I love taking care of sick or complicated patients. Why not we call it complex disease management and do a little pilot? And so far it's been pretty well received by the patients, for sure, just because simply enough, they feel like they're being listened to.
Yes.
And that's just, it's so important.
Yes, absolutely. So let me ask you a question, and then we'll move into the last question after that. But before I do that, for anybody that's still here and listening, thank you so much. Please like, comment, and share, and subscribe. If you haven't subscribed yet, what are you waiting for? Get out there, hit that like button, and share this with somebody that you know can benefit from it. So, Dr. Otten, for those healthcare professionals who feel like they don't have time, like their heads are buried, they feel like their heads are buried in the sand of taking care of patients, and maybe taking care of patients and all the administrative charting and everything, and it just feels like that's all they have. How would you how would they be able, like, how would you tell them how they can effect change?
Oh, wow. I think it depends. Not everybody has the capacity to just shift gears and, or write a book or all these other things, right? Mm-hmm. But I often talk about time, talent, or treasure. Okay. If you're strapped for time, maybe that's not where you can affect change, right? Or maybe you don't feel comfortable, being on a podcast or speaking up or whatever.
Yeah.
Or maybe you do. So time, talent, and treasure. Okay. So, if you have the time and you can donate to a nonprofit or something like that, sure. If you have the talent and you think you can connect with somebody in your local institution to start to peel back some of the layers where there's an opportunity for positive change, that's amazing. But if not, what about treasure? Donate $5 to a nonprofit you like. There's a ton of them out there doing amazing things. The Lorna Breen Foundation is one that immediately comes to mind. Obviously, I'm biased because I work with Medicine Forward, Doctors for America, the Kern National Network. The list goes on and on and on of amazing organizations that are wanting to move the needle in the correct direction. And so if you feel like, hey, I'm doing too much pajama time, skip a cup of coffee and donate $5-10 to one of those organizations would be my suggestion.
I couldn't even have said that any more simpler, because that does allow you to play your part in some way. Or if you can't give the time, if you don't feel like this is your lane to be able to, you can still affect change in donating to something. So I couldn't have said that better. Now I'm going to ask you a final question. And so this is the final question. What do you know now that you wish you knew earlier in your career?
Notice the big deep breath because I'm trying to narrow down the list. Oh my gosh, there are so many things that I wish I had known earlier in my career. And I guess to maybe put it in a plug for coaching or a mentor for our younger colleagues, that would be a wonderful thing to pursue. But simply stating the ability to say no is critical. We are taught to just say yes and continue to do more and more and more. If you say yes to everything, you are certainly saying no to something. And that is the antithesis of balance.
Absolutely. Absolutely. The power of no. Dr. Otten, this is such a pleasure. And actually it's probably a good thing that your computer's probably gonna die.
That was not intentional, Judy. I swear it was not intentional.
But where can people find you, reach out to you, and let them know where they can get the book?
Oh, for sure. Thank you so much. I'm most active from a social media perspective on LinkedIn. If you Google me in LinkedIn, I'll pop up for sure. In terms of the book, if you want a signed copy, which I think is the coolest because you get not only my signature and Joshua's signature, you can go to rippleofchange.us, but it's also on Amazon. It's on Google. It's on Barnes & Noble. We do have an audiobook version that is more of a subscription model, but Audible is like imminent. So if you want it on Audible, just wait a few seconds.
Very good, very good. So this was so good, and please do not be shocked if I reach out to you and have you on again, because this was so good, and there were so many different ways we could have gone with this. But I am so looking forward to all the things that you all are doing, and it's great work and it's necessary work.
Well, thank you so much for having me, Judy. This has been a true joy, and keep up the good work yourself.
Thank you. Thank you very much. Okay, well, everyone, thank you for joining and for listening, and we will see you next time. Bye for now.